welcome to episode 3 of Nip and Nosh. I still don't know if we're going to do that every time. It's so funny. Okay, so today's episode is all about Alyssa's IVF journey. Yeah.
And I know that we kind of briefly touched on that in episode 2. So if you haven't listened to episode 2 yet, it's called the elote episode, and you'll hear why.
Perfect. Okay, well, I guess we could dive in. We'll start off where we kind of ended in the elote episode, where you tried to get pregnant for a full year, and then they just said, yep, you'll need an infertility doctor.
Yes.
Or a fertility doctor.
Yeah. So, oh my gosh, I clearly remember just being off of birth control for a year and then going back to the doctor and just letting them know that, you know, I still wasn't pregnant. And they took me out into the waiting room where there were tons of other pregnant moms in the office and were like, yeah, you're going to need fertility treatment. And I just remember like sobbing on the way home. And I just wasn't sure, like, how do I even go about this? But ended up reaching out to insurance just to see, you know, how this could possibly be covered. Is this something that we could do? And at the time, we had PPO insurance, and unfortunately, with these type of treatments, only HMO covered that. So luckily, that was possible for us to do. We just had to wait until the next year in order to change our insurance. But we still couldn't do any of those types of tests until the new year. So we had to wait until that time until we had the HMO insurance to start any of that. So it was kind of just a waiting game with that. And then once we got the clearance from our insurance to do that, I had to go through a ton of tests. So there was one test called an HCG where they send a bunch of fluid through the reproductive tract in order to make sure there's no blockages, everything looks good, and then lots of blood work and exams from doctors and
everything.
Love that.
And you were saying that, like, thank God there was a fertility place nearby, because otherwise you would have had to drive.
Yeah. So luckily there's a place in Crest Hill. It's called Kind Body, actually. And it's a pretty big, like, a national organization. But unfortunately, that Crest Hill location closed. And the reason we chose there, too, is because you have to go daily for blood work, ultrasounds, all of these different things. And, you know, that was convenient for going right before work and then going to work after that. And so that's definitely scary if we potentially needed to do this again and, you know, having to drive really far away to do that now with a toddler.
Yeah, and imagine if you didn't have a car or, like, the resources to do that every day, like, this wouldn't have been an option for you. So, like, you have to have some sort of privilege to do this too.
Right.
Even though it's not a privilege to be having fertility issues, but just to be able to get it. The care that you need.
For sure. And yeah, especially daily. I think that was a big, like, emotional toll too, having to go in constantly for those different things. I understand why. I know why we needed to do that, but it was definitely a lot at the time. And then my husband had to do a lot of testing too, because they had to, you know, see whose side is this fertility issues coming from. And it was definitely me. So not him. So, but he still had to go through testing. And so I know that that's, you know, not really comfortable either, but, you know, he did everything that we needed to do to make it happen. And so then once we finally got the clearance from insurance to start, we met with the doctor, and they were kind of talking about the different options. So there's, like, the IUI that a lot of people have heard of, and then IVF. So they're very different, though. So, and I think people get them confused sometimes. So do you know?
I didn't know any of this before we spoke about it. So
okay. So just briefly, so the IUI is the intrauterine insemination. So that's basically you're still ovulating yourself, but then they would have to use the sperm from the person, and then they're able to inseminate you with that. And then, but they told me for, like, my conditions with PCOS and most likely endometriosis as well, that, you know, the likelihood of the success of that is very slim. So then they were like, you know what, we can just go right to IVF. And I was worried that insurance was going to be like, no, you have to do the IUI first. But then the doctor was like, yeah, no, this isn't going to work for you. So let's just go right to IVF. So I was like, thank you. Like let's not waste, let's not waste any more time with this. So, and then I know that a big thing that people get concerned about is the medications and everything that is involved in that and the injections. It was definitely a lot. I think the the first part was definitely the hardest, where you have all the injections to kind of grow the follicles in your ovaries. So that's both of the ovaries. They're trying to grow the follicles as big as they can, so then they can go ahead and retrieve those for the in vitro. So, and I'm sorry, I should have mentioned, so the IVF is the in vitro fertilization. So instead of just using the sperm and inseminating, they're actually fertilizing the eggs and creating an embryo so that they can just directly implant the embryo.
Yeah, whenever
instead.
You told me that, so a follicle and an egg is kind of like, the same thing.
Yes.
But I didn't realize that. And then you said that they give you this medicine to mature the follicles in your ovaries. And did you say they grow to like softball size?
Yeah, so the ovaries were absolutely massive, because you think instead of just doing the one a month like you normally are, they're growing as many as they possibly can, because they want to retrieve as many so they have as many chances for those follicles to be mature and then fertilized. So some people can have up to like 30 of them. I did not have that many. I think I had 14 follicles that they retrieve. So then and they do those ultrasounds every day to kind of monitor the size and how your body is.
Every day.
Yeah, how your body's reacting to the medications. So, and then I can show a picture too of one of the ovaries with the follicle. It's just absolutely massive. And then you're kind of able to see, and they're measuring it too every day to see the size. And then once you're ready for those to be retrieved, then you actually have to go under anesthesia for that. So I was knocked out for that, because they actually have to put a needle from your like vaginal canal into your ovary to retrieve those follicles out.
That sounds horrendous.
Yeah, so I was out.
Well, that's nice they put you out.
Yes.
They're not like, here's some Tylenol.
Yeah, no.
Deep breathing.
Yeah, I was very much out for that. And I kind of thought that after that, they did that it was going to be immediate, that they were going to be able to fertilize and then implant. But it was actually like a month and a half that we just waited. And I'm like, I want to do this yesterday. Why are we waiting so long? And then after that point, started more medications. So again, the first round of medications that you're doing are more so to like grow those follicles in order for you to retrieve. And then after that point, you're kind of prepping your body for the pregnancy. So making sure that the progesterone's really high. And my progesterone was just like so low, like almost like not even traceable. So, and that's the hormone that you need to make sure that you can like establish and then maintain the pregnancy. So then before that transfer, you start doing the progesterone injections, and all of the ones that you do to start are in your stomach. And then after that point, you have to switch to the booty
Would you
injection.
prefer the booty injections, or do you prefer the stomach?
No, the stomach was,
Really?
I was like, oh my gosh. And then once I started doing the ones for your butt, I was like, and these are terrible. So, and it was so funny because Brian, my husband, he used to have like a fear of needles. Like their whole family has a fear of needles. And so I was so worried. I'm like, who is going to do these injections for me? And he was like, I wouldn't even know where to do it. So the first day that I had to do those injections, I actually brought it to work, because where we work, we have nurses there. And I'm like, they're going to know where to do this. So I asked one of our nurses, I said, Caroline, would you be okay like doing the first injection for me? And then like marking on my butt where the injection needs to go for Brian. So I wore my best lacy underwear that I had for Caroline, and she literally took a Sharpie and marked an X on my butt.
Love her. I think I have your next tattoo idea.
An X on my butt.
Yes.
So then, yeah, I went home and pulled the pants down, and he knew where to give the injection the next day.
And I was telling you, because I did the depot shot for my birth control, and I think it's like every 3 months you have to do it. And that was terrible. I hated it. I would be shaking and like cold sweats. And you were doing that more than once a day, right? Yeah, that's insane.
Yeah, it was crazy. And yeah, just you were so bruised from everything. And you would try to like switch spots to where you were so it wasn't so bad. But yeah, it was very painful. And we tried to make it fun though. Like every day we would choose like a random song to listen to. Like I'd put on like a rap song. Or
I love you guys so much.
just to try to make it fun, I guess.
And I
want to
bring up the fact that Alyssa documented everything. So she has a little scrapbook and she has all the paperwork and everything. So I thought that was so cute. She kept a little journal. Like, this is like a big thing. And your in-laws gave you a gift. Like, people are giving you, like, your boss gave you like a little goodie bag. Like, this is a big process.
Yeah.
And I feel like people don't realize that. They think this is like an easy way out or something when it's not.
Yeah. And I wanted to be able to look back at it one day and be like, this is all that we went through to have her, and just how lucky we are that this worked, because for so many people, you know, they have to do multiple rounds of it, or they have a miscarriage, or, you know, there's so many different things that can happen. So even though the process leading up to it was so difficult for us, like, we couldn't be more lucky with how it ended up. So yeah, very fortunate for that. But yeah, I just wanted to document everything.
That's good. I'm glad you did, because now we can share it with everyone.
Right.
And I'm sure it's like, it feels like a lifetime ago probably at this point, but.
And I wanted to document like every negative pregnancy test that I took, every little thing. So just to, again, show how blessed I am to have my family. And
yeah, we were kind of talking about how like this, whenever, so they fertilized the follicle and then they implanted it in you, and then you continued to do shots for up to 10 weeks.
Yes, yeah, 10 weeks, because that was kind of the point. Then, like you were saying, like then your body kind of takes over at that point, and they were monitoring my levels that whole time just to make sure that everything was good. But the implantation process was so funny, because I remember going in and, you know, we went into this little waiting room just kind of waiting for it. And they were like asking us our names repeatedly. Like they were like, who are
like
you?
Jane the Virgin type thing. Like,
I mean, we were being like interrogated, like, who are you? And, you know, just making sure we're the right people. Because you've heard stories and people were scaring me. They're like, your baby is going to be the fertility doctor's baby. I just remember being so terrified. Like, and then this one documentary came out literally right before we did IVF about this guy, this fertility doctor who fathered like 100 kids.
That's terrible.
So I was just terrified of that. And then literally as we were walking to the room, they asked us our names. And then when we got to the room where they were going to implant, they asked us again. And I'm like, y'all were just with us.
That's crazy.
but I mean, hey, that's good.
Yeah.
And the embryologist, his name was Eduardo.
Shout out.
Rico. He was definitely like a Rico Suave type of guy. And I literally remember, you know, because you have to have your legs up in these stirrups. They're getting ready to implant. And he has this little like trucker window that he kind of just leans over, and you're aiming his way, and he's just, you know, handing you the embryo is in like a massive like pipette, like not test tube, but it's just in this really long pipette. So he's seeing everything. And I'm like, you know what? I have my dignity is completely gone at this point, but he sees this all the time. So like he handed the embryo to the fertility doctor through the window, and then they had to use like a speculum, and then they put the embryo in, and they're doing an ultrasound at the same time. So you can actually see the embryo going into your uterus. And it looks like a little orb. It's so cool. It's like, there. So yeah, after the egg retrieval and then them being fertilized, so we ended up with 7 embryos. So, and again, luckily we only had to do 1 round, which we're so blessed for. And then so we still have 6 embryos that have been in storage this whole time, and it's expensive to keep them frozen. But yeah.
Does insurance cover that at all?
No.
You pay out of pocket?
Yes.
Is it like per embryo that you pay for?
Yeah.
Wow.
Yep. So then part of us was like, what do we do? And we had to fill out paperwork that was like, would you want to donate them? Like, if something happened to me, would Brian have ownership of them? What would he do with them? Like, we literally had to decide all of these things prior to them being frozen. Yeah. So would we donate them to science? Would we donate them to someone else? What would we do with all of them?
Oh my gosh.
Yeah, but we still have 6 right now, and
you have pictures of each one too.
yeah. So,
and you tell me a little bit more. I don't know if there's a lot to talk about with the quality.
Yeah,
of
so
the follicles.
all of the different embryos were given a certain quality, and so I always joke that I'm like, Charlie was the best quality one. So imagine if we decide to have another baby, it'd be like, well, she's gonna be like, well, I was the best quality one, not you.
Right.
But so the day that they're frozen actually makes a difference. So they want these embryos to be about 5 days. That's kind of like between 5 and 7 days. That's like their prime time. So the embryos, they're categorized like day 5, and then AA would be the best quality, then AB, then BA, and then so on from there. So Charlie was 4AB. That was her quality rating. And we had no idea the gender of the baby. We had no idea like any health or medical issues, anything like that, because we did genetic testing on me and Brian beforehand. But then to do the other testing, it's called PGT, and that insurance did not cover that, and it was $5,000. So we were like, God. Yeah, no, we're not doing that.
You could go through all of this, and baby could still have like some sort of genetic disorder.
You have no idea.
Oh my gosh.
Again, you only know if you are a carrier or have a condition.
So they give you a list of the things you're a carrier for, but then they don't tell you if the baby actually has any of that.
Correct. So it's not until the baby was, I think we did, because we had to do genetic testing during my pregnancy, though. That was kind of part of the high risk follow-up, because I was categorized as high risk due to IVF. Then we did the genetic testing around 10 weeks, I think, and then everything came back normal. But yeah, so we have no idea if we have boys, girls, mixture of both. Yeah, we have no idea about it.
And you were saying after they implanted Charlie in you, that your progesterone was so high that they thought you had twins, or was it the HCG?
The HCG. So yeah, they were like, it was almost like triple what they're looking for, the baseline amount. They always say that the risk with fertility treatments, that the risk for multiples, and we actually wanted to implant 2 embryos, and they were like, no, because obviously that's you're more high risk with multiple pregnancies. So they didn't want us to do that. And now I'm like, thank you. Thank you for not letting us do that, because, I mean, hats off to anyone who has multiples.
Yes. You're amazing.
We have one, and I'm like, whoa.
Yeah.
That's good.
So of this grandpa.
Yeah. Yes. So, then we only implanted one with that.
Good.
Yes. Yes.
Well, you talk about this, and I see all the stuff that you saved, and it just makes me like want to cry, because like you were the best mom and the most deserving to have babies, and it's just like the fact you had to go through all this, and I just didn't have to do any of that. Like I feel guilty almost.
No, and that's the hard thing too, is because you're so happy for everyone else, but then in the back of your head you're like, when is it my time? And that, I think that was hard. We didn't have troubles in our relationship together, but in the back of my head with Brian, I was always like, am I good enough? This should be something easy. Like, this is what my body is meant to do. And we would always see, like, our neighbor, they had a baby right before we started fertility treatments. And oh my gosh, I just remember they came home from the hospital, and we were all sitting in the driveway, and Brian was holding her. And I was like, I literally had to go home, because I was like, that should be our baby, and so that was really, really hard. And I'm like, what if I can never give this to him? And,
like, does he regret marrying me?
I know.
Like, all of that would probably go through my head too.
I know. And so, at that time too, we were kind of looking into like, should we become foster parents? Like, what would adoption look like? All of those different things. But even that, just like fertility treatments, they make it so, understandably, they make it very difficult for you to be able to do that. And so an adoption was, over $10,000. And so,
what on earth?
I know.
It doesn't make any sense.
I know. So yeah, it was a lot, but he was so supportive of me the whole time, never made me feel like I was, inferior, or that I was bad because we were having difficulties. And
good.
Yeah. And once we started the treatments too, it definitely, it became more fun, because we weren't so focused on like, we're doing this to get pregnant.
Yes, yeah. The fun came back.
Yes, we were out of the hell week. No more hell week. Like, this is not fun.
Oh,
do your job.
That sucks. With your legs up in the air afterwards.
Did that multiple times. I can't even tell you how many times I did that.
Oh.
But it's okay. You learn so many different things, and yeah, no more of those ovulation tests or anything, because all of that didn't work.
Yeah, it didn't work. And infertility we were talking about is so much more common nowadays. We didn't bring up any statistics or anything, but it's just so much more common than what people realize. So
Yeah.
I feel like it's good that you were willing to talk about this, because I'm sure this brought up a lot of extra trauma. And
Yeah, I know. Yeah, and I really wanted to talk about it too, because I'm sure there are some people who could possibly be listening that might be going through this, and just to know like that they're, not, it's very isolating, and for them to not feel alone, and it's people are talking about it a lot more, which is so good. It needs to be talked about more. And
like on the Mormon Housewives.
Yeah. Yes. Well, no, Macy did IVF, and Sammy from Jersey Shore did IVF too. So yeah, a lot more people are talking about it, and I'm just glad that we can be of a support, and just keep going, and just everyone's so proud of everything that you're doing. And
yes. And please leave a comment or reach out to us.
Yeah.
Like, we want this to be a community where you can share what you're going through and have other people build you up and share resources. So maybe
your story, if you did the IUI or IVF, or how everything went with that, or where you went to do those treatments, we would love to hear all of that.
And that was another thing that I asked Alyssa about when we first started talking about this, was like mental health. Like, did they offer any counseling or like a support group or anything that you can remember? And
not that I remember, and I don't want to I don't want to bash them in case they did offer it to me, and I was like, no. But I know that they sent information about dietitians though, so they have like specific dietitians for like the fertility doctors, but I really don't remember them saying that here would be a support group if you needed it. So,
and you didn't change anything with how you were eating or anything like
no, at that time no, but honestly I just remember being so incredibly nauseous. That was one of the things with all the hormones, and you tend to gain a lot of weight when you're on those medications too. So that was kind of a struggle. But then once I got pregnant, lost all of that. So yeah. But they didn't really, that was one thing they didn't really counsel me on. So they were, just telling me all of the different medications to take.
They didn't warn you were going to gain weight?
No.
Or any of that?
Oh gosh, no.
Or the nausea?
No.
But so you were nauseous when you were taking the medication, but also gaining weight at the same time because all the hormones?
Correct.
How weird is that?
Yep. So I felt very attractive during that time. But
well, you're amazing again. And having to go to work, because you would do this before work.
Before work, yep.
Every day.
Yeah, because I didn't want to have to use sick time, in order to go to all these appointments. And luckily they had openings, and, it was 15 minutes away from work. So it worked out. But just thank you so much for letting me share my story with everyone. And
thank you for sharing.
Such a big part of my life. So I love being able to share it with everyone.
Thank you for sharing.
Yeah.
If you don't already, make sure to follow us on our socials. So TikTok and Instagram at Milk and Spoon Co. And YouTube, if you're not already watching that here. And Spotify. We're on YouTube and Spotify at Milk and Spoon Co.
And that's episode 3 of Nip and Nosh.
Okay,
Lord.
That's it.